Will the Committee of Supply please come to order? This section of the Committee of Supply will now resume consideration of the estimates for the Department of Health, Seniors, and Long-Term Care. Questioning for this department will proceed in a global manner. The floor is now open for questions. Member for Roblin.
Thank you, Honorable Chairperson. Can the Minister tell us how many nurses have left private agencies and are now employed in the public system in the last fiscal year, and where they were hired and into what kinds of positions?
Minister of Health.
Well, we looked for clarity on those questions. I do want to talk about something I shared yesterday. So the critic asked questions about the provincial float travel nurse float pool. And I did share yesterday that we have approximately 300 nurses in that float pool. That these are nurses, for the most part, who have left the private sector and have returned to the public healthcare sector by way of the float pool. And the increase is about 117%, which it's massive. It really is. So under our government, we've seen a 117% increase of nurses entering the float pool and providing care across our province at different sites. The total hours were over 127,000 total hours worked. I believe the total shifts were 10,200 and an odd number around there, 10,200 shifts that have been covered as a result. Those are significant stats, but they're not enough. We recognize that we want more nurses. We want more nurses to join the float pool and to work the front lines of our healthcare system in the public sector. That's part of the reason why our government, working with Manitoba Nurses Union, has made the decision to not cap the number of nurses who join the float pool. We want to make sure that all nurses who want to join that way of practicing are able to do so. And we also have invested a significant amount of resource into really strengthening the staffing side of the float pool so that we can process applications more quickly and engage nurses more consistently. Now, we know that there's much more work to do on this front. The float pool, there's still a lot of opportunity with the float pool to improve the process so that nurses really have a seamless experience when they bring their applications forward and then join the public sector again and are working on the front lines. And that work is being done. I've requested for Shared Health and the folks who are managing the float pool to provide me with their recommendations and a request to further enhance the float pool, and I look forward to seeing that and supporting that. And I want to be really clear, when nurses have brought forward ideas or concerns about the float pool, when MNU has done so, we've reacted and responded very quickly. This is a priority for us, making sure we're strengthening the public system and the public health sector. I do think it's important that in an era, in a time, which I don't think any of us could have imagined we'd be in right now, where we see President Donald Trump attacking our nation's sovereignty, imposing these tariffs that are really, really detrimental to our economy as Canadians, certainly here in Manitoba, and directly impact the healthcare system. It is so important that we are all united in championing universal healthcare, championing a strong public healthcare system, and not doing what we've seen some folks choose to do. The leader of the opposition I mentioned yesterday thanked Donald Trump for tariffs. Mind-blowing, pretty jaw-dropping approach to take. And, as the health minister, I take really seriously our responsibility to enhance public health care, to respect and honor the Canada Health Act, and to do what we can to protect Manitoba jobs, including in the healthcare sector. So we're going to keep doing that. And I will continue, and our government will continue to focus on bringing Manitobans and Canadians together under this united message of being proud to be Canadian, being proud to be Manitoban, celebrating that while we have an imperfect universal healthcare system, we have a system that puts people first. And I've had the opportunity in my life, thankfully, to travel and to be in other places where they don't have universal health care, including in the United States, and seeing that, one diagnosis can bankrupt an entire family. We believe that everyone deserves to access health care, and that the right to access health care shouldn't be based on the size of your bank account. So we'll continue to protect those values and do work to strengthen public health care, including through the float pool.
Thank you, Minister. Member for Roblin.
Thank you, Honorable Chair. I assume we're still waiting for an answer to the question, so I'll just proceed with my next question. And I'll add some clarity to the minister's comments there. The Leader of the Opposition never thanked Donald Trump for tariffs. That's nonsense being spewed by the NDP, and it's one of those things that they think if they repeat it enough times, it will become the truth. But the reason it's not catching on is because it's patently ridiculous. But the minister talks about tariffs, so I'd like to ask, what steps the minister or the department have taken to protect Manitoba's healthcare system from the impact of tariffs? For example, what impact will tariffs have on the cost of medications and healthcare supplies, and what contingency plans are in place to mitigate the impact on Manitoba's healthcare system?
Minister of Health.
I'm going to just read a direct quote from the Leader of the Opposition, the MLA for Fort White. Trump wants a win. And I think one of his clear wins, and a lot of Canadians' wins, was a change in federal government. He wanted JT gone, and thank God he's gone. So how much of an influence did the 25% tariff threat have on that? I would say a lot. And I would say thank you. I would say thank you, he's gone now. End quote. Those are the remarks of the Leader of the Opposition on Donald Trump and the tariffs. Those aren't my words. Those are the words I've directly quoted from the MLA for Fort White. I'd like to talk a bit about what the critic has raised, and that is the very real threat that our economy does face as a result of Donald Trump's attack on our economy by way of these tariffs. That's a very real threat that we're facing, and our government has brought forward a strong 25-26 budget that is prepared to respond. I also want to highlight the fact that there's another narrative that the Leader of the Opposition has brought forward that the member for Roblin, the critic, seems to also support, and this is this language of privatizing healthcare. I heard, and I've heard this many times, MNU, Manitoba Nurses Union, nurses say very clearly that they want a strong public healthcare system, which is why it's so concerning that the Leader of the Opposition, Leader of the PCs, wants to privatize healthcare. The critic started her questions today asking about nurses returning to the public sector from the private sector, and yet their caucus seems to want to privatize healthcare. So, I think Manitobans, I hope, are paying close attention to this. Our government has been very clear. We believe in a strong public healthcare system, so much so that when we came into office, the previous government, just for folks who may not be aware, had been fined $350,000 by the federal government for violating the Canada Health Act. Our government made it a priority to make very clear. In my first call with the former federal health minister, Mark Holland, we talked about this fine. And I reassured him that our government was committed to respecting the Canada Health Act and working in partnership with all levels of government who are willing to strengthen public health care in Manitoba for Manitobans. And our government worked very hard, and we actually saw that $350,000 fine that was levied against the former PC administration returned to Manitobans, returned to our province, so that we could reinvest those dollars in strengthening healthcare. We take our responsibility to strengthen and protect public healthcare very seriously. Recognizing that there are many different aspects of healthcare and partnerships, be it with physician clinics and other partners, some private clinics as an example, where we do partner to strengthen public healthcare. And so our government focuses on what's the best for patients, what's the best for Manitobans, how do we work with all levels of government partners, stakeholders across our province, across departments, in order to make sure that we're making the right investments for Manitobans in the right ways at the right times. And that's an approach we're going to continue to take. To answer the member's prior question, out of the approximately 300 nurses who have joined the float pool, the 117% increase to the float pool numbers under our government, 68%, so about just over 200 of those nurses have returned from the private sector to the public sector in this float pool, which is a substantial percentage. We're really happy to see that. But again, we've been very intentional about not capping the number of nurses who can join. We are going to, as a government, we're going to continue to add the resources and capacity necessary to ensure that any and all nurses who want to join the float pool are able to do so. And because this is something that is evolving and is a novel idea here in Manitoba, we recognize that there may be some bumps along the way that we have to work out, but we're committed as a government to making sure that we address any concerns should they arise and keep moving the float pool in the right direction. And I want to thank all the nurses who have signed up, put their names forward, and are part of the float pool team.
Thank you, Minister. Member for Roblin.
Thank you. And, you know, it's really a shame that the political discourse in our country, and more specifically in our province, has just degenerated into this contest over who loves Canada more, who hates Trump more, but that seems to be the level that the minister wants to operate at, so I'll play. Why did their government launch a Trump-style attack website using Trump-style tactics at taxpayer expense? Why does the minister think that that's an acceptable use of taxpayer dollars?
For all members, as we are in estimates, so please ask the questions relevant to the estimates, not out of scope of the estimate. So I would request the member to please ask another question. Thank you. Member for Roblin.
Fair enough. We'll save that one for QP. I'll instead turn my line of questioning. Oh.
Member for Red River North.
Thank you. Point of order, Honourable Chair. Just on clarity to the Chair's response to my colleague's question. In listening to the answers provided by the Minister, there was a number of answers provided with the reference of the new leader of the official opposition being a Trump fan, and also quotes that were not tabled but were repeated here at the table. So I question the Chair's comments to my colleague regarding her asking a question with respect to that after it's already been talked about by the Minister.
Thank you for the comments, member for Red River North. I notice the minister did talk about leader of opposition, but the minister did bring their remarks back to the estimates. So this is not a point of order. Thank you. And also, I would request all members to stay relevant to the estimates. Member for Roblin.
Thank you so much. And again, I would be encouraged by your intervention, Honourable Chair, and hope that that will result in actually getting some answers to the questions that we're asking. I did ask a question about steps that the Minister or the Department have taken to protect Manitoba's healthcare system from tariffs. from the potential impact on things like the cost of medications and on healthcare supplies, and what contingency plans have been put in place to mitigate the impact on both the healthcare system and on the impact to taxpayers. So I'll return again to that question in hopes that the minister has an answer.
Minister of Health, Seniors, and Long-Term Care.
Thank you, Chair. I appreciate the question from the member for Roblin. It is a really important question. You know, we're in an unprecedented time right now, and jurisdictions have had to mobilize very quickly and find new ways of approaching things in order to ensure that we are prioritizing our Canadian economy, local economy. I think folks will remember that very recently, well, I guess not so recently anymore, a few months ago, our government made an announcement about buying local, supporting local, and buying Canadian. And that's a sentiment that I have to say, doesn't matter where I go, people are united in that front. You go to the grocery store, you go to the pharmacy, people are looking closely at labels, shelves, and they're doing what they can within their capacity to support Canadian. And that's really wonderful. I see people still maintaining that elbows up mentality. And I think we'll continue to see that from Manitobans and from Canadians. It's really important. And so as a government, we, like jurisdictions across the country, have been working very, very hard to take steps to protect our healthcare system, to equip our healthcare system to be a part of our economy in a responsible way. I know that other ministers are working very hard and doing the same. Minister of Agriculture, I know, is working very, very hard. We know that food and agriculture has a direct connection to health and health outcomes of our communities, no matter where you live. And it's been really wonderful to see my colleagues, ministerial colleagues, working so hard and fighting for Manitobans and for Canadians. And, you know, it's really a unified front, not only here, but across the country. I've had really good conversations with other health ministers in other jurisdictions. You know, there's an openness generally in terms of how do we work together to make healthcare in our respective provinces or territories better for the people that we represent. But certainly now, folks are really reaching out and making sure that we are, as much as we can, be aligned and to learn from one another in terms of the strategies and approaches that we're taking. Our government recognized in the 25-26 budget, I mentioned before, that we would have to be prepared to respond to any tariff threats or the imposition of these harmful tariffs. And we've been working very hard across departments. Certainly health has a big role in this, to actively do the work of securing new sources of supplies for healthcare. So new sourcing strategies, developing new sourcing strategies is a big part of this work. Finding new procurement opportunities is a big part of this work. And fundamentally prioritizing Canadian, wherever we can, and outside of Canada, not the US, in order to meet Manitobans' needs, is an important part of that. All of that being said, I want to be very, very clear that our top priority is the healthcare and well-being of Manitobans. We are always going to put the health and well-being and the outcomes of Manitobans first and foremost. And we've been able to do this work of sourcing new supply chains, companies, whatever it is that we need to adjust in terms of healthcare, while keeping the outcomes, the health outcomes of Manitobans at the heart of that work. We're also actively working with the PCPA to identify non-US pharmaceutical supplies and to engage in listing them in our new agreements. So the PCPA is a really important fundamental organization in our country. I actually had the opportunity to meet and listen to the experts at the PCPA, the folks who are on that board, and hear what they have to say and share a little bit about what we're doing in Manitoba. So I want to thank the PCPA for the work they're doing. And ultimately, it's a united front really across the provinces and territories to address this threat in the most responsible ways. And here in Manitoba, we're doing the necessary work, recognizing that it's not a short-term effort. This is going to be a long-term effort that we're committed to doing, with Manitobans being put first.
Thank you, Minister. Member for Roblin.
Thank you. And I think a lot of that was really nice words, but it didn't actually answer the question substantively. I think what Manitobans want to be assured of is that the government has done an analysis of what impact tariffs could have on our drug supply, for example, or on medical supplies that we need in our hospitals and personal care homes. They want to be assured that we're not going to be dealing with shortages or an inability to import what we can't get here at home. And I think Manitobans also want to know what the cost impact of that is going to be if it does come to pass. So I guess I'll just rephrase my question. Has the department done any analysis of these factors, of the impact that tariffs could have on the drug supply, on the supply of medical devices and other supplies that are needed in our healthcare system? And what is that impact going to be?
Minister of Health.
While the department pulls up some of that information for me, I want to just add a little bit of my thoughts to this, a bit more detail. The critic is asking really important questions. This is an issue, again, it's a generational challenge that we're facing right now. We've not seen a kind of a breakdown in nation-to-nation relations like we're seeing now, because a sitting U.S. president has attacked our sovereignty in this way and has taken this sort of position and approach. But here we are. And in Manitoba, we recognize that we must be prepared to respond and, again, protect Manitoba jobs, protect our healthcare system. I'm sure the critic, can appreciate the complexity of this work and the amount of work and effort that goes into an analysis of that nature. I want to thank the Minister of Finance for his department's efforts on this front. And our departments and our teams work very closely together, making sure that the way we do healthcare in Manitoba is certainly much more fiscally responsible than the previous administration's approach was. And we've been able to see the benefits of that partnership and that collaboration across government departments. We have folks in our own department who have stood up new infrastructure in the last couple of years to really strengthen the way that we as a government approach finances and health, and to also support other regions, other regional health authorities to have strength in terms of their fiscal approach. And I want to really highlight that it takes a tremendous amount of work, expertise, and effort to do that kind of outreach. And that kind of work is really also rooted in relationships. And folks in our department on the finance side in health are doing an outstanding job, not only building that capacity and developing new processes that are helping our government function better, but to also go out beyond government, build those relationships with regional health authorities and our partners, and offer support to those folks so that they can have more fiscal capacity and sustainability and be more responsible and accountable. And to me, that it's been something that's been certainly a challenge. It's been, again, a lot of effort, but our team has really risen to that challenge and has supported other regions in being able to do the same. And so this work that we've undertaken in terms of responding to the tariffs and what it means for healthcare is not just solely the government of Manitoba, right? The reality of it is that we have to reach out to regional health authorities and our partners, and also ensure that folks are aligned with this Buy Canadian approach, with this new reality we're in, where we will always put Manitoba patients first and put their health outcomes first and foremost, but also look at ways that we can find new supply streams, procurement methods, relationships that will allow for us to support our local economy, build new relationships and partnerships with other suppliers from other countries, not the United States, while also ensuring that our healthcare system remains innovative, responsive, and is meeting the needs of Manitobans and Canadians. So there's a lot of work that's happening on that front, and making sure that we are communicating to every regional health authority that this work is happening, folks are participating and being consistent, that's part of it. Certainly understanding, like, where does the opportunity reside, right? Are we looking at the pharmaceutical space? Are we looking at the technology space? Is it digital? Is it building? Is it materials? Health, so much of it is what people think of automatically when they think of health. They think of maybe BP cuffs and code carts and DPIN machines and things like that, but it's also structures. It's like literal physical structures that are being built and developed. So there's a lot to consider, and all of that work has been happening furiously, again, across departments and with partners at the table as well. So I hope that provides a bit more clarity for the critic, and I look forward to providing a bit more information when I have it available.
Thank you, Minister. Member for Roblin.
Thank you, and appreciate that answer, because I think it is a really important question, and I think it's one that's it's top of mind for a lot of Manitobans. I want to shift my questions to a topic that the minister will know is important to me, breast cancer screening. And the minister promised to lower the breast cancer screening age for Manitobans to age 45 by the end of 2025. But I noticed in the supplement to the estimates on page 37, where this topic is discussed, that there is no mention of that. So I just wonder if it is still the minister's intention to lower the breast cancer screening age to 45 by the end of this year.
Minister of Health.
Thank you, Chair. I just want to offer a bit more information because I do think it's important. The critic was asking questions about tariff impacts and the work that's being done. I'd like to provide a bit more clarity on that, just because I do think it's important. So I mentioned the PCPA previously, and so just for everyone's awareness, the PCPA and Health Canada are responsible for drug importation and pricing analysis. I think folks maybe generally are aware of that. But that's the work that they do, so those are their responsibilities. And I want to reassure the critic and other folks that provinces and territories, with support from Canada, are actively engaged in assessing the impacts, developing mitigation strategies. So that work is intensive, the work is happening, and it's happening at the appropriate levels. As I mentioned earlier, you know, the complexities of the reality that we're facing right now are huge. Doesn't mean they're not doable, right? This is work that is important to be done and done the right way. And certainly it's work that is achievable when you're working truly in partnership and collaboration and across jurisdictions and at all levels of government, which is what we're doing, and that's what's happening right now, which is a wonderful united effort. And you know, in health, we want to make sure that we're doing our part. This is a health concern, it's a health issue and health challenge in a very real way. But it certainly affects every sector, every system in all of our provinces and territories. I recently was able to engage in a conversation with the Canadian Medical Association, and it was wonderful to participate in that conversation with Dr. Reimer. The health minister in Ontario was there. Mr. Fleury was there from out east, which was great. And it was moderated by Andre Picard. It was a really good conversation. It was wonderful to hear the perspective of folks, what they're doing in their respective jurisdictions, but to also understand what the CMA's position is in this. And I think a lot of folks recognize that there's a unique opportunity that we have right now to find innovative ways to not only address this immediate threat and concern, but to strengthen our own local economies and health infrastructure for generations to come. And so, as much as this is a real challenge and threat, we are also choosing to see this as an opportunity that we cannot waste. We've got to maximize this and make sure we do what we can to benefit Manitobans. Budget 25, as the critic I'm sure is aware, positioned us to respond. As I've stated before, we essentially provided two budgets, making sure that there's a tariff-ready budget and a situation if we don't face that reality. So our government understands the seriousness of the situation and made sure we were prepared to respond. If there are more questions on that from the critic, I certainly encourage her to have her colleague pose those questions in finance estimates, where some of those questions would be better answered. The last thing that I'll note is that all provinces and territories have agreed to undertake this work through the PCPA in regards to medications, et cetera, that the member asked about, to ensure consistency and a common beneficial approach. All jurisdictions honoring and respecting the role of the PCPA is very, very important. We've seen in our province some challenges that can arise if that's not the case. It is really good to see jurisdictions working through the PCPA in this process, and we're hoping for a unified and streamlined and consistent outcome as a result of that.
Thank you, Minister. Member for Roblin.
Thank you. I just want to reiterate my not a follow-up question, my next question. While I appreciate the additional comments from the minister, the question was about breast cancer screening and whether the minister still intends to lower the breast cancer screening age for Manitobans to age 45 by the end of 2025, as previously promised.
Minister of Health.
Thank you, Chair. I think the critic for that question, breast health and women's health and those who need access to this health care is a huge priority for our government, huge priority for our government. You know, I had a conversation, I participated in a town hall just last night in regards to reestablishing not only the Victoria Emergency Department, but the Mature Women's Center. And we know that the previous Mature Women's Center was able to support women and those who need that care with things like breast health. That was a really invaluable service in that way, and unfortunately it was closed, it was cut by the previous administration. We're bringing that back. I heard from a number of women last night who were very emotional, understandably emotional, talking about mature women's health care and how they're thrilled to see a dedicated effort to women's health, and they fundamentally understand the importance and the value of it, but the feeling of having women's health care, their health care, devalued and dismantled for years, and the consequences of that. There was a woman I spoke to last night who talked about the fact that this isn't just about her, that this is about her daughter growing up and being able to access the kind of health care that she deserves and to feel respected in accessing that health care. And that really struck me. That really, it struck me. I thought about it for the rest of the night, actually, that, you know, the decisions that we choose to make in regards to women's health care can have generational positive or negative impacts. And our government is focused on making decisions and investments in healthcare for women that have positive generational impacts. And certainly doing the work around breast health and breast cancer screening is a part of that conversation. So I'm just gonna, the critic referenced page 37 in the estimates book, so I'm just gonna read from there and talk a bit about what our government is doing in the 25-26 budget. So our key initiatives are expanding breast cancer screening capacity with a focus on increasing access for the BIPOC, which is, for those who may not know, Black, Indigenous, and people of color populations who are currently being screened at a disproportionately lower rate. When people talk about DEI, and a lot of folks have tried to really sort of misrepresent what DEI is. This is a good example of what DEI is. It's recognizing that BIPOC communities, Black, Indigenous, and people of color, racialized folks, are disproportionately disadvantaged from being able to access essential life-saving health care for a whole host of reasons. And that if you are not intentional about reaching those communities, their health outcomes are damaged and worse as a result. And our government recognizes that for far too long, there are communities that have not been brought into these conversations and have not been prioritized in terms of healthcare investments and healthcare approaches. Our government's doing things differently. We want to make sure that BIPOC communities, that folks who are marginalized, have access to this life-saving essential healthcare. And so we're working with our partners like Cancer Care in order to take the important steps that will close those inequities, close those healthcare gaps, and improve outcomes for all Manitobans. When you improve healthcare access and services for marginalized groups, you're actually doing the work that benefits everybody else, and we understand that. And so in our 25-26 budget, we're going to increase focus on breast cancer screening for BIPOC Manitobans, and that's going to support our objective to expand screening for women and those who need it aged 50 to 74. Our department's going to fund the expansion of screening diagnostic infrastructure and staffing to address the inequities in access for women between the ages of 50 and 74, including mobile services, mobile breast cancer screening, which was cut multiple times by the previous government. We're investing in strengthening that, and community outreach to the identified populations, going out, meeting people where they're at in communities to make sure they have the information, awareness, and access. Our target in 25-26 is to improve Manitoba's 59% screening participation rate to at least 70% by the end of the 25-26 fiscal year. I'm really happy to share, actually, that in 24-25, through our efforts and partnerships, we were able to increase our screening rate, not quite at the 70% that we were hoping to get to, but to 66%. So the work we're doing with our partners is already improving the rate of women who need to get screened who previously were not getting screened here in our province. We know there's much more work to do.
Thank you, Minister. Member for Roblin?
I thank the minister for the answer, but it's disappointing to learn that it is no longer the minister's intention to lower the breast cancer screening age to 45 by the end of this year. I think that Manitobans will be disappointed to learn that today, particularly because Manitoba is one of the last provinces to do so. Within the last year and a half, most other Canadian provinces have moved in that direction. And certainly moving in that direction would benefit BIPOC Manitobans because there's an increased incidence of breast cancer in younger women in BIPOC populations. I know the minister's aware of this. I think that the many advocates who have come to the legislature to talk about this issue, who've been vocal with the media, were certainly led to believe that the province was moving on this issue, and certainly believed the minister when they publicly told media just last fall that by the end of 2025, the screening age would be 45. This is a disappointing development and positions Manitoba women behind those of other Canadian provinces. So I wonder if the minister could just clarify how many screening mammograms are currently happening in Manitoba?
Thank you, Member. And Minister of Health.
Thank you, Chair. I'm not sure about anyone else. I was sitting very confused listening to the critic's response to my answer. Nowhere did I say that the breast cancer screening age wouldn't be lowered. I was just sharing the other information that I thought was really important and relevant, including that here in Manitoba, our government is working very hard to make sure that underserved, marginalized communities who have historically not been able to access breast cancer screening and have worse healthcare outcomes as a result are able to do so. We're working very hard to make sure that Black, Indigenous, and people of color, women between the ages of 50 and 74, hit that target screening rate of 70%. That's our goal in our 25-26 budget. Historically, that number was under 60%. I'm not thrilled that we're not at the target yet, but I am happy to share we're moving in the right direction. In our first budget, by working with our partners, from listening to women, we were able to bring that screening rate up from 59% to 66%. We're getting closer to that 70% target, and quite frankly, I'd like to see us get beyond that. I thought that was a really important thing to share and to put on the record, that the work that we're doing with our partners matters, and that we are listening to women, particularly those who have been marginalized and not a part of the conversation for far too long. But I also want to make clear that these efforts are part of a multi-year approach. We know that this expansion of breast cancer screening needs to happen, and we need to increase access for all those who need it. And so it's a joint effort between our department and Cancer Care. As stated on page 37 of the estimates book, it will help ensure that breast cancer screening is expanded to women between the ages of 40 and 49 by the end of 26-27, meaning that in that journey, yes, the screening age for breast cancer will be lowered to 45, as we've previously stated and committed to by the end of this year. So I want to reassure the member, again, I'm not quite sure why she thought differently. I didn't state otherwise. It's implied in this estimates book on page 37 that that is the case. We are lowering the breast cancer screening age to 45, and we are going to lower the breast cancer screening age to 40, as we stated previously and as we've committed to Manitobans. We are also doing the work of making sure that those folks who have historically not been able to access screening in marginalized communities will be able to do so, and we've set some targets in regards to that as well. So it's a pretty comprehensive approach. I wanted to use the time to share that with Manitobans and with the critic because I do think that it matters. It's one thing to talk about setting these targets. It's another thing to elaborate on how you're going to get it done and who you're going to prioritize in this work being completed. So I want to thank our partners at Cancer Care. I want to thank in particular Dr. Turner, who's been wonderful to meet with and is a leader in this space. I want to thank the advocates, the women in Manitobans who have reached out to me directly and have shared their personal stories. We're listening, and we're lowering the breast screening age for you this year, and we're going to keep moving forward and lowering it to 40 moving beyond that.
Thank you, Minister. Member for Roblin.
Thank you, and I thank the minister for that clarity. In their first answer, they talked around the issue and actually never specifically stated that when that was the direct question that I put. And that's why I inferred the answer that I did, because the minister's answer was so unclear. And in fact, the supplement to the estimates does not imply anything at all. It only states explicitly that it'll be lowered to 40 to 49 by the end of 26-27. It doesn't say anything about this year or the age of 45. And 2025 is the fiscal year we're in. One could be forgiven for thinking that it would make it into the supplement for the estimates of this fiscal year. So I'd like to ask, how much additional capacity for screening mammograms will be required in order to achieve this target?
Thank you, Member. Minister of Health, Seniors and Long-Term Care.
Thank you, Chair, and I thank the critic for that question. I appreciate her commentary on why she assumed that maybe something had changed. I would encourage her to not assume. Our government is committed to following through on our commitments to Manitobans. In particular, women in this province who for years watched as their health care was cut and dismantled, watched as women's health care was deprioritized, devalued for years under the previous PC government. women deserve better. It's fundamentally important that we invest in research, in technology, in innovation, and in essential healthcare for women. And at the heart of all of that is listening to women. And our government listens to women when it comes to everything, but certainly their healthcare needs. And it's been really wonderful, the conversations I've had more recently with women in this province, different parts of this province, talking about their healthcare needs, what they would like to see, what matters to them. Certainly breast health is a big part of that conversation for many folks. I think most of us have been affected, impacted in some way, shape, or form by cancer. And, I think about people in my own life who've been affected by breast cancer and what their journeys and their stories mean to me and how we do this work. I'm grateful to be in an opportunity with our government where we can sit down and engage in these really important conversations with Manitoba women and those who need this care and take action on their behalf. We recognize that so many years women's healthcare was cut and mistreated is going to require a lot of years of repairing and work and investments to not only fix, but really strengthen and have it be in a place where Manitoba can be a beacon for other jurisdictions in terms of how we treat women's health care. And we're taking steps in the right direction while recognizing there's much more work for us to do. So I talked in my previous response a bit about the work we've done to improve the access to breast cancer screening for marginalized communities, and that we're moving the needle in the right ways, and the targets that we've set for ourselves and who we're working with. We're also working with local, smaller organizations than Cancer Care. But I want to talk a bit about what our budget 25-26 is going to do in this space. We are going to increase screening. So we're going to be able to take screening from 45,500 screens in 24-25 to over 65,000 in 25-26. Our government is investing in a 44% increase in breast cancer screening for women in this province with our 25-26 budget, because we know that this area of healthcare is so important. This budget, 25-26, also includes more screening for marginalized communities. It means that over 15,600 breast cancer screens will be completed and available for self-referred Manitobans, right? So we are lowering the breast cancer screening age, and for those who are self-referred, we're going to have an opportunity to have almost 16,000 screens done. That's a substantial increase. We're also ensuring that because we're lowering the breast screening age to 45, that in the first few months of the new calendar year, which is the few remaining months of the budget year, we're going to be able to have 4,000 Manitobans get access to screening who are 45 years of age. So our government takes this very seriously. We're making very real investments where we saw divestment years prior. Mobile breast cancer screening is a way that reaches many, many Manitobans in rural communities, northern communities. Mobile breast cancer screening was cut for multiple years by the previous government. We're doing the opposite. We're investing in making it stronger, better, and more accessible, because we know that Manitobans can get care in that essential way. And we're going to make sure that we continue to do more work so that more Manitoba women benefit from this screening and have better healthcare outcomes as a result.
Thank you, Minister. Member for Roblin.
Thank you. As part of this, of course, we know increasing screening capacity is going to require increasing the healthcare workforce. So I'm just wondering if the minister could provide the current number of mammography technologists in Manitoba, how many have been hired since the minister became the minister, and how many more we need in order to increase screening capacity.
Thank you, Member. Minister of Health.
That's a really, really great question by the critic. We're working on getting some more clarity around those numbers. I'm not 100% clear. I think the number was either 13.6 or 12.6, somewhere in there in terms of the amount of mammographers that we would need by 26, 27 in order to meet those lowering the age targets. So we're going to get clarity on that. What I can say is that our government has worked with our partners across the healthcare system and post-secondary institutions to reach out to students, to learners, healthcare learners, before they graduate, to make them aware of the opportunities to advance their learning and training and job opportunities in our province. So in anticipation of lowering the breast cancer screening age, recognizing that we would need more human resource capacity, we started doing the work of planning, right? We started doing the work of recruiting, informing, and retaining folks proactively. We recently had a graduating class of, I believe it was 26 technologists being trained in the province. And we reached out, normally, you know, our government has established this new practice where the Premier and I send out to learners a letter letting them know that there's a job right here in their home province for them when they graduate. We've seen that be very successful. It's a great way to let folks know. I didn't receive a letter like that when I was going to be a new grad. Would have been nice to. Certainly, we know that folks were not getting that letter under the previous administration, but we felt it really important to reach out as a government to say, there's a job for you in your province, should you want one, and we would love for you to stay right here. And so we took it a step further in terms of the graduates and the new grads who would be responsible for technologist roles in our province. And we said, we know that we're going to need more mammographers. That requires additional training beyond your initial studies. And so we reached out proactively and asked if folks would be interested. We provided them an opportunity to access mammography training right away and said that we would love for you to choose this path. These are the goals that we have. We know that women in this province need more access to screening. And we're really happy to see that folks had an interest in that. And just by making that effort, making folks aware of the opportunity and engaging them proactively, we saw some uptake there. And so we're taking unique approaches in order to ensure that we have the staffing that we need to meet the needs of Manitoba women and those who need this care. There's more work to be done on this front. Certainly, you know, across the country, there's a shortage of healthcare workers. Here in Manitoba, we were late to getting into that effort in terms of recruitment and retention and being innovative in that approach. But our government has stood up a retention and recruitment office, a dedicated office to healthcare human resource, and we're seeing the benefits of that. We have physicians, we have allied healthcare expertise, who are all working with our office, nursing expertise, working with our office in order to ensure that we're moving staffing in the right direction. So the critic is correct. More staff, more resource is necessary in order to support lowering the breast cancer screening ages. And our government is doing that work with our partners to meet those needs. Recognizing again, there's more work to be done, and the 70% target for screening that we want to achieve, which is recommended by the Canadian Cancer Society, we're only going to be able to do that by working with our partners, by having more healthcare human resource capacity and being creative about how we do that. The last thing that I'll mention is there's an organization I've met with a couple of times named CIRC, really wonderful organization that does a ton of really wonderful outreach to women in our communities. And they have a couple of folks there who do outreach specifically in newcomer communities. And I want to thank them for being willing to meet with us and being open to using their relationships, their structure as a way that we can engage women in health conversations that meet the needs of newcomer communities. It's important that we recognize that healthcare and screening and education awareness isn't a one-size-fits-all. We have to be able to be creative about how we reach people and make sure they have the tools they need to make the best and most informed healthcare decisions. And so, you know, we've been in government now for about a year and a half, just over that. We hope to have many years ahead of us to do this work, but building positive relationships is a big part of how we get this work done. And so we're going to commit to continuing to do that collectively.
Thank you, Minister. Member for Roblin?
Thank you, and I hope that the numbers that I asked for will be forthcoming here this afternoon about the number of technologists that we currently have, how many have been hired, and how many more we need in order to meet the screening target. And I'm going to ask one more question on this topic, and the minister talked about the need to increase screening uptake, which, yes, is very important. But, you know, last year the minister intervened to stop a campaign that was going forward that would have increased screening uptake. It was eye-catching. I personally did not find it offensive. So I just wonder, I have a couple of questions. What exactly is the minister or the department doing to increase screening uptake, and do all of these campaigns need to be approved by the minister personally before they're allowed to go ahead?
Thank you, member. Minister of Health, Seniors and Long-Term Care.
Can I just ask the critic to repeat the question really quickly, if you don't mind? I just want to make sure I have the right information.
Member for Roblin.
Thank you. I had reiterated my question about the number of mammography technologists in place, including the number that have been hired under the minister's tenure and the number that we think we need in order to increase screening capacity. And then I had shifted to talk about breast cancer screening uptake and asked what specific steps are being taken to achieve that.
Thank you, Member. Minister of Health.
So I appreciate the question from the member. She heard in my previous response that we are seeing an improvement in the percentage of women who are being screened, which is important. So the national target, as identified by the Canadian Cancer Society, is 70%. We are moving towards that. We've improved as of our 24-25 budget, and we want to get to that target and, quite frankly, surpass it. And in order to do that, we do need greater human resource capacity. And so the number I referenced previously, the 13 point something percentage, that number, 13.7 FTEs, is actually only related to lowering the age to 40 to 49. But when we think about the fact that our government isn't just committed to lowering the screening age, our government could have said, we're going to lower the breast cancer screening age, and left it at that. But we said, no, we need to improve the percentage of women and those who need this care who are actually getting screened. That if you only lower the screening age and you do nothing to make sure that more women have access to the information and the opportunity to be screened, you are probably only going to result in privileging people who already have privilege in accessing those services. Of course, we want all women and those who need this care to receive it. What we need to be mindful of is that we don't, as an unintended consequence, push out not only the conversation, but the opportunity and the access those women who are already further removed from the opportunity and the chance to be screened. And so we have made it a priority to ensure that marginalized women, BIPOC, Black, Indigenous, and people of color, that we have an intentional approach to making sure that we are reaching them, we are speaking to them, we are working with our partners so that they have greater access to breast cancer screening, education, and information. That is fundamentally important, and that requires a sustained effort and investment and a teamwork-based approach, which is what our government is doing. As a result of that, we need substantial staffing resources dedicated to this, and we're investing in that. In order to reach that target of screening 70% of the population, we need 15 additional FTEs. 7 or almost 8 additional FTEs in terms of lowering the breast cancer screening age to 45. We're looking at over 20. It's a total of 23 additional FTEs that we are actively filling and hiring into, and we have been able to recruit folks into doing this work. There's a number of folks that we need in order to make sure that we're meeting the needs of Manitobans. So these efforts, again, are not being done in isolation. We're working directly with Cancer Care Manitoba and other local organizations in order to do this work the right way, in a meaningful way, and we're listening to Manitoba women. There was a woman at the town hall last night who spoke really well and asked us very directly if the Mature Women's Center is going to be representative. Are we going to have people there who look like the communities that they serve? I thought that was such a great question, such an important question. And it came from someone who was involved with the Mature Women's Center before it was cut and closed by the previous government. She's excited, of course, for this to be reestablished, but she wanted to make clear to our government that equity matters, that ensuring that all women from diverse communities have the ability to access this incredible care. And I made very clear to her that that is the approach our government is taking. We want all women in this province to have improved access to breast health services, and we're committed to working with partners in order to move us in a better direction. And so I want to thank, again, those folks who are working with our government on this front, and we're going to do the work alongside Cancer Care and our partners to retain, to train, and recruit folks in order to do this work in the right ways.
Thank you, Minister. Member for Roblin.
Thank you, Honorable Chairperson. I want to shift back to a question that I asked yesterday. I'm just reviewing the Hansard here from yesterday's estimates. And I asked the minister a couple of times about something that was announced last week with the ER wait time reduction strategy. And nowhere in the strategy was there a actual target for how much the government intends to reduce ER wait times by. But later in the media scrum following the news conference, the minister said that they planned to lower ER wait times by 1 hour. But it wasn't clear if that was 1 hour in the city of Winnipeg, is that 1 hour in rural Manitoba, is it 1 hour in Brandon, is it all of the above, and 1 hour from what? Actually, no, I'll correct myself. I believe the 1 hour from what was clarified, but it's not clear where that target came from or what it applies to. So I'd just like to once again ask the minister to provide that clarification.
Thank you, Member. Minister of Health.
Thank you, Chair. I apologize to the critic. I neglected to answer another part of her question previously in regards to how are we going to reach people advertising? How are we going to communicate? I do think it's really important that when we look at advertising and promotions and things like that, there may be some things that get the members' attention or my attention or your attention that absolutely do not make any sense or resonate or land for other people. And that's fair. We're all different, right? But I think it's also important to think about the fact that there are a number of folks who still yet are not being screened. Folks who are community members who perhaps English is not their first language, perhaps they are newcomers, perhaps the things that may land or resonate very quickly or easily for myself or the member opposite don't for other folks. And it's really important that when we put out campaigns or communications that we do our best to be inclusive. And I know that the word inclusion is something that people have been talking about DEI in interesting ways in the States lately, but certainly here in Manitoba, we recognize the value and importance of inclusion and taking approaches that include as many people as possible in participating. And so we do think it's really important to work with local organizations who understand the communities that are not currently being screened, who have historically not been reached by ad campaigns. And we listen to them, we work with them to produce or have materials produced that are able to reach those folks. We want for folks who are taking the bus with their kids and who see an ad campaign to see it and connect with it right away. That could be the moment that a woman in our communities thinks to herself, you know what, this is the time I need to go and make sure I get screened for breast cancer. We want for as many people as possible when they see a communication to feel connected to that and to feel welcomed into a conversation that is directly about their own health. And so there's more work to be done on that front. Certainly, I think the government has a role to play. I do think that one of the most important roles that government can play is setting the tone. When a government makes the decision to cut and close services, to damage the health care that disproportionately serves women, in particular BIPOC women, or those who need that care, that government is sending a very clear message about whose health care matters. Our government is taking the approach that we will talk about women's health care, we will talk about menopause and hormone replacement therapy, we will talk about menstruation and periods and reproductive health care. We will talk about all of these things because it is health care and it matters. And we will not only talk about it, we will invest in it. We will build relationships. We will staff the services that provide care to meet those particular needs. We will listen to experts locally. We will sit down and have conversations. We'll bring forward legislation to enhance and protect that care and those essential fundamental freedoms and human rights that women and Manitobans hold near and dear. And as a government, we will do that unapologetically. For too many years, Manitobans had a government in place that took a different approach that was very harmful. And now, especially now, in the political climate that we're in, It's important, and it's incumbent on governments to make very clear where they stand. And our government and myself as a health minister have been very clear. We stand with women. We stand on the side of women's health care and science, and we are going to make investments that strengthen that, and we're going to listen to women to make sure that their voices are heard and fundamentally a part of how healthcare decisions are made in Manitoba.
Thank you, Minister. Member for Roblin.
Thank you, Honorable Chairperson. So for the record, that's the fourth time I've asked about the ER wait times reduction target and not received an answer from the minister. And we've been down this road before. I think the minister put the same words on the record the last time we were in estimates. And again, I have no problem talking about abortion, birth control, women's body parts, periods. I'll talk about all those things. I'll talk about those things all day. But that wasn't what the question was about. And it also is a little bit rich coming from a minister who's dodging the fact that, what I put in one of my last questions was that this minister personally canceled a campaign to improve breast cancer screening rates because the campaign used the names of birds in a tongue-in-cheek way, and the minister found this personally offensive. So they canceled that campaign. So I've asked now twice, and the question was, what is the minister doing to increase screening uptake? So I put a few questions on the record now. The minister can take their pick and answer whichever one of those they'd like.
Thank you, Member. Minister of Health.
Thank you so much, Chair. I unlike maybe the critic, I love birds. I think they're beautiful. I love when the season changes and you can hear them first thing in the morning. But I don't know a whole lot about I know geese, blue jays, some ducks, eagles. But unlike some of my near and dear friends, some of which work in this building, I'm not a birder. I couldn't look at a poster or a campaign with any particular bird and make the association between a particular bird and a message necessarily. And I think that some of the concerns that were brought forward actually from folks, from Manitobans, from women who found that particular campaign, some folks did find it very offensive. I heard that plainly from a number of Manitobans. But some other folks also found it very confusing. They actually didn't understand it at all, which I think is also a big concern. The critic has talked about, and she acknowledges that there are marginalized communities who are not being reached, and that needs to improve. When I hear from Manitobans that, from some folks that a campaign is offensive, that concerns me. When I hear from other folks that they simply don't understand what it's saying or what it means at all, and that the message around breast cancer screening is not remotely getting through to them as a result, I think that's a problem we have to be willing to acknowledge. And it's okay to say that we have to do better. It's okay to say that we can do better. I think Manitobans deserve that. And our government has been working very hard, and as a result, under the previous government, we knew that the uptake for breast cancer screening for particular communities was low, and that we weren't reaching the target, the national target of 70%. Our government in our first budget was able to bring that up close to 70, but not there yet. We know there's much more work to do, and we take that very seriously. And so we're committed to doing that work. I actually have answered the member's question in terms of how we're going to do it. Of course, there's going to be communication and ad campaigns, encouraging folks to access the information. We're working directly with Cancer Care Manitoba and other organizations to make sure that the information is more widely and broadly distributed, that it's more accessible by the way of language and visuals and even locations in terms of where the information is being made available. And we're adding the staffing, we're adding the people so that we have more resource to do this work to reach more people. That is so important. It's so important that you have as many people as possible doing this work, doing the outreach in communities to meet the needs of Manitobans who previously were not involved. And I want to say, I do know that the critic has no problem talking about reproductive health care, periods, menstruation, menopause, mature women's health, abortion. But unfortunately, I think that member also knows there are folks on her team who cannot. For years, Manitoba had a PC government with health ministers who would not talk about reproductive health care. couldn't talk about menstruation, refused to even acknowledge abortion. And as a result, those health ministers weren't responsible for those files. They moved it under the families minister. And I know this because I was a frontline nurse. I know this because I served as a part of organizations that deliver primary health care, abortion care, reproductive health care. And they couldn't reach out to the health minister because the health minister wouldn't talk about those important, essential healthcare topics. If that doesn't send a clear message to Manitobans about whose healthcare and what healthcare matters, I don't know what does. When I became the health minister, the premier did not sit me down and say, you know what, you're not going to talk about, minister, abortion? Absolutely not. That would be ridiculous. As the health minister, women's health care, reproductive health care, abortion care, which is essential, protected human rights health care, those are all issues we're very proud to talk about and invest in making better for Manitobans, recognizing there's more work to do. So, you know, I think it's important to be clear about the fact that, you know, the critics' ability to talk about things, sure, great. It'd be wonderful to know that every single member in her caucus also supports that and is able to talk about that. I know that there are members in her caucus who were former ministers of health who went to anti-choice rallies. That's concerning. It's worrisome. It's troublesome. So when we're talking about breast health, I want to be very clear that we're committed to making the necessary investments, and we are making the necessary
Minister's
investments.
time has expired. Member for Roblin.
Thank you. And I think the minister's, again, straying very far from the topic at hand. And as much as I have enjoyed our exchange here this afternoon, I am going to cede the floor to our colleague from Tyndall Park until 5 o'clock.
Member for Tyndall Park.
Thank you, Honorable Chairperson, and I would just like to begin by thanking my colleague from Roblin for the opportunity to ask some questions here this afternoon, scheduling some time, as well as the Minister and the departmental staff for being here and answering all of our questions. The first question I have is about the Seven Oaks Hospital. It's something the Minister knows I have raised on multiple occasions. I often hear from my constituents about how underutilized the Seven Oaks Hospital is currently being used for. We know that the population in the North End continues to grow. All of the areas, our population has really skyrocketed over the last couple of years. We know that the need is there. And often, again, these are concerns I'm hearing directly from my constituents. The North End does feel that they are neglected, not just under NDP government, but previous governments as well. But what are the plans specifically for Seven Oaks Hospital? Is the ER in fact going to be reopened? Are there plans to make changes within the next fiscal year? Just something that I can bring back and share with my constituents.
Thank you, Member for Tyndall Park. Minister of Health.
Thank you, Chair. It's good to see our colleague from Tyndall Park here. I really appreciate that question. She's such a strong voice for her community, and I really appreciate that. Those are really important questions. I had the opportunity early in our administration to be at Seven Oaks and visit with different teams there, and I know that many of my colleagues have learned more about the programs that are at Seven Oaks, really, quite frankly, groundbreaking services that they provide there, particular programs. And it was great to hear from them directly. So what I can tell you is that we, very early on, when we rolled out 7-day-a-week discharge, Seven Oaks was included in that. So they were provided additional staffing capacity for allied health to help with flow, but fundamentally to help with patient care. So previously, they wouldn't have had 7-day-a-week allied healthcare professional capacity, and they have that now. We weren't prescriptive. I just want to be clear about that. We weren't prescriptive, not even region to region, site to site. We didn't take that approach. We allocated those resources and said, folks could design what they needed based on their site needs. What I've heard from some folks is that it took a little longer than others to identify, is that going to be more physiotherapy and social work, or is it going to be, recreational services and something else? That it depended on really what the site decided their needs were. And so I can't speak with clarity as to what Seven Oaks chose to do in terms of how they utilize those new resources, but I can assure you that they were allocated those resources to do with what they needed. And also recognizing that for some sites, that changes over time, right? So perhaps they had a vision at the outset and then decided to pivot to see greater impacts. Another area that we're going to be sooner than later enhancing at Seven Oaks is primary care. So we've been able to do that through extended hours primary care clinics, minor injury and illness clinic at Misericordia Hospital, the extended hours primary care clinics at the Grace and Concordia. And we recognize the growth in that part of the city and recognize the importance of making sure that more people have access to enhanced primary care. And so we're looking at that for that area as well. I'm not sure how familiar the member for Tyndall Park is in regards to what we've been doing in terms of that primary care space, but the way that we've structured it has allowed for us to maximize the existing resources in terms of diagnostics and the structures that are already available. We've been able to have primary care providers who are willing and wanting to go there and practice in the evenings, weekends, and holidays. We're also incorporating nurse practitioners, which we think is a really, really important part of that model. So Seven Oaks will benefit from that, actually. More resources for nurse practitioners in that part of the city and your community, which I think is really key. We've seen by now it's over 11,000 Manitobans benefit from these clinics, and we know that that's going to be a very, very well-utilized clinic, the enhancement of primary care there when we establish it. And we also know there's more to do. There's more to do, right? So Seven Oaks Hospital, unlike some others that I've had the opportunity to visit, one, I would say meeting with them was great. They've not had a visit from a health minister, which to me was like shocking. I've heard that a lot. Health ministers previously in the previous government hadn't actually gone to sites and visited with folks and heard from them directly. Personally, I really enjoy it. You get to hear directly from people in their environment, but we know there's more to do there. And as I was saying, unlike some other hospitals or sites, they actually have a bit of space that they can work with, right? So there's more opportunity to work with Seven Oaks and partner with Seven Oaks, I think, to create some really unique care opportunities. So we're currently exploring that. I'm not entirely sure just yet how that's going to be executed, but we're looking at those options. And of course, staffing, right? We need more people in healthcare, certainly at Seven Oaks. So our retention and recruitment office is working with the Winnipeg Regional Health Authority to identify ways to not only retain, but to train and recruit more folks to go specifically to that site.
Thank you, Minister. Member for Tyndall Park.
Thank you, Honorable Chairperson. And just for the sake of time, I am going to be jumping around a little bit for topics within healthcare. With respect to home care specifically, I remember there was a time here in Manitoba when home care included a lot more than it does currently. There was a time when it included things such as shoveling driveways, helping with groceries. It was a lot more inclusive for those who were experiencing or needing home care services. Everyone knows we don't have enough home care workers. It is an issue. We've heard issues, as I've heard issues from constituents where home care workers have had to go from one house to another, and it doesn't allocate any time to actually spend within the homes with the constituents, with the people who need the care, home care services. We've heard issues of last-minute cancellations. This one seems to be happening more and more recently, unfortunately. What is being done not only to hire and retain home care workers, but to ensure that those who are receiving home care services don't continue, because they currently are, don't continue to fall through the cracks, miss out on services, have to go sometimes weeks without being able to have the services that I would argue is part of our dignity, needed services. What is the government doing? Is there a plan? Are there specific actions planning to be taken?
Thank you, Member. Minister Health.
Thank you, Chair. Really appreciate the question from the member for Tyndall Park, who I know has been talking about home care for many years and really been an advocate for that. I'm someone who worked as a support worker in community for years before, when I was a student, before I was a nurse, and really appreciate on a personal level the work that people do in our communities, in people's homes, right, and the relationships that are built and what they foster. And what I do know, and the member probably already is aware of this, we were both in opposition when this was happening, getting calls from people who were saying that their home care services were being cut and changed. So some of the services that the member talked about, you're totally correct, were in place previously and were really scaled back under the previous government, which obviously was concerning. I have a constituent of my own here in Union Station who's been really vocal about this and would call me, and he and I have had many, many calls about how his home care was cut and the impacts on him as someone who is a paraplegic. And so, you know, our government coming into government, you know, having heard those concerns for years and seen the impacts of those cuts to home care, recognize that this is an area that we really have to be very intentional about, that we need to do the work of restoring services. I know that recently the rollout in home care in terms of the centralized scheduling, you know, the WRHA has essentially kind of conceded that this hasn't gone well, right? There's been real impacts as a result of the rollout not going the way that they had hoped or intended. They're working very hard and very quickly to rectify some of those challenges. I would say at a broader, higher level, our government has worked with the regions across the province to have more capacity in home care just generally. So investing in regions being able to train more folks and hire more folks into home care. We've done that not only in the WRHA, where the member has a constituency she represents, but in other regions as well. And working with them directly to sort out, well, what does it really look like? What does home care look like in your communities? Our government also has a commitment to ensure that there's home care services for kids living in First Nation communities. So that work is also happening to expand those services. We're working in partnership with First Nations to do that work. And, you know, in regards to the recent centralization and the rollout of that, I want to be clear that what the member is talking about is correct, that the change to centralized scheduling actually came as a direct result of a review that was done because a family was unable to get the home care that they needed in time, right? It's a very devastating circumstance that a Manitoba family experienced. I had the opportunity to talk to Mr. Deskepper myself, and he's been a really big advocate and a proponent for change. And so one of the recommendations out of that review was to centralize scheduling. Again, recognizing that the rollout has not gone the way it was intended, there's a lot of work being put into addressing that now. So we've been investing in more home care, more jobs, more training opportunities, all of that, investing in more capacity. This particular rollout, the WRHA has been very responsive. They've held several town halls with nurses and frontline staff to hear their concerns and to leave those town halls and take action to fix the concerns and strengthen home care. I attended one of those town halls very recently and heard directly from nurses and managers myself. They've hired 19 new nurses into roles, and they've hired 10 more as of this week who will be joining. So that's a total of almost 30 additional staff members to do this work. They've added another manager to help with this work and to not only help stabilize but really strengthen home care. And they have additional training that's been rolled out for folks. So there's a number of measures beyond that. I just wanted to make sure the member was aware of a few of the measures that have been actioned, and recognizing there's much more work to be done. Beyond the immediate concerns regarding the rollout being addressed, we're committed to continuing to retain, train, and recruit as many people as possible into home care, and also improving structures like the self and family managed care option, right? That process can be kind of confusing for some families, and we want to make sure that that process is much more seamless, easier. We also want to make sure that those opportunities are there for First Nations, Indigenous peoples across the province. We've had really good conversations on a nation-to-nation basis in terms of how we can expand and improve that as well.
Thank you, Minister. Member for Tyndall Park.
Thank you, Honorable Chairperson. On the topic of regulating talk therapy, psychotherapy, is something that I've raised over the years, again, with previous governments and with this government. And I think it's really important that Manitoba start to take an initiative, start to take the lead on regulating talk therapy for a multitude of reasons, a couple of being one, coverage for folks who are seeking out talk therapy. Oftentimes people go to begin and they decide not to because there is no coverage, and it can often be very costly on Manitobans. We've seen it now be regulated in other provinces in across Canada, not every province, but in a few. And it's something that I believe that we need to take action on sooner rather than later. The other reason it's really important, and I know that the minister is aware of this, is that those who are providing services, we need to ensure that they're trained to be doing so. We wouldn't want someone who is providing physical healthcare services doing so unless they were properly trained. If you break an arm, you want someone to fix your arm who knows what they are doing. It's the same case with mental health. As of right now, and it's a scary reality, anyone can practice therapy. You can be a a person who has not received your high school diploma and make yourself business cards, call yourself a therapist, charge $150, and treat people, talk with people who are arguably in some of the most vulnerable situations and cases. So we need to make sure that it is regulated so that those who are performing these services are in fact properly trained to do so. Does Manitoba have any plans to regulate talk therapy over the next couple of years?
Thank you, Member. Minister of Health.
Thank you for the question. We are engaged actively in conversations with different therapy bodies. So I'm trying to find the right language here. I apologize for my pause. We're having conversations with different therapeutic organizations and representatives rather, who are expressing their concerns and ideas for what they think the path forward needs to look like. I certainly take the member's point. I know that the member has her own expertise and her own training in this area. So, and I respect and appreciate that. I think we need more folks with that level of education and training to provide care to Manitobans. So I want to thank her for taking that on and being somebody in the province that folks can benefit from when they need that kind of support. And we know, and the member is well aware, I think we're all well aware, there are more Manitobans than we've ever had who need this kind of support. And I wholeheartedly agree that we need to make sure the people who are providing that care are safe and qualified. And we've had really good conversations with different bodies who have provided recommendations and their thoughts on this, including the recommendation to develop some sort of a centralized way to identify folks that are appropriate and safe, which I think is a really good recommendation. I know that there's currently websites that do that, but perhaps, an approach where, not necessarily sure who would lead or be responsible for that, but I think the government can play a role in that. One place that people can go to get that information and know that that information's been vetted somehow, but I certainly take the member's point in terms of the regulated health professionals being an important part of that work and conversation. There is a report that I'm eagerly awaiting from the Health Professionals Advisory Council, who will be providing a report with recommendations on this issue and others. And I look forward to seeing what's in that report. But I do want to reassure the member for Tyndall Park that we are aware of this issue. We're doing work in this space. The member is well aware of, there's a number of different therapies and ways of practicing. And so also understanding, as we look at the path forward with the Regulated Health Professionals Act and folks coming under that, what does that mean for this particular body, right? Because there's so much uniqueness in terms of different therapeutic modalities. So I'd be happy to keep that member up to speed in terms of how that work is unfolding. I can make sure that when that report is released and we take a look at it, I take a look at it, I'd be happy to have a follow-up conversation based on that. This is an important area, and I take the safety of the public and their health very seriously, no matter how that health care is being provided.
Thank you, Minister. Member for Tyndall Park.
Thank you, Honorable Chairperson. A few years ago, when the government was in official opposition, one of the things that they often talked about was restoring healthcare coverage for international students. I've had, over the last couple of years, I'm going to argue probably close to 50 over the last couple of years, international students actually come and see me at McDonald's on Saturdays. And they always express to me how is it going to happen? And I've often been very optimistic with them and suggesting that, the government really stood strong on this prior to the election. I believe that their intention is to bring it forward. But we're going on 2 years now, and international students are more than halfway through a lot of their degrees who have been waiting on it. What does the minister recommend I share with these international students who continue to come to me and ask when it's going to be restored?
Thank you, Member. Minister of Health.
I want to thank the member for Tyndall Park for that really important question, and I know that she's been a good advocate on this. I want to reassure her that we are continuing to work on this really important commitment that we've made. And I just want to share that, and I've said this before in regards to other healthcare issues, that it is so much easier to cut a bed, to close an emergency room, to fire a nurse, than it is to add a bed, reopen an emergency room, and hire a healthcare worker. The reality of it is, unfortunately, we had 7.5 years of a PC government that was pretty callous, that cut healthcare every which way they possibly could and didn't really care much about the consequences. I remember when that happened. It was a $3.1 million cut. And I remember looking at that budget line and thinking, like, why? And knowing how it would impact people. And what I can tell you is that we are working very hard to find ways to address this, recognizing that it requires a lot of work and collaboration to restore that cut, as we've seen for other areas, right? But the work is happening. And so if you could go back when you meet with your constituents or folks who are reaching out to you, when you're having coffee with them at McDonald's on Saturdays, which I think is phenomenal that you continue to do that, you can let them know that you and I have had a conversation about this and that work is ongoing. We know it's not happening fast enough. Previous government cut 500 beds from the healthcare system. Our government has been able to add about 280 beds back to the healthcare system in just about a year and a half. You know, that's still not enough, right? It's much easier to cut and close and do damage than it is to add capacity and to fix that harm, but we're doing it. And so I look forward to having conversations with international students. We've had the opportunity, myself and many of my colleagues, the MLA for Radisson, my legislative assistant on health, has been wonderful meeting with international students and different student representatives and having these conversations. And we've been working with advanced education and training as well, so that we can work with post-secondary institutions and make sure that they also have a role to play in this conversation
Order,
and see how we
please.
can work together.
The time being 5 p.m., committee rise.